ostomates through advocacy. So without further ado, I'll get Elo to share screen and play a video that introduces the OAS. Elo, please.
Thank you, Dr. Vincent. Dr. Vincent, back to you.
Yep. Congratulations to OAS on the soft launch of the association and their website. Now, to kick off the proceedings this morning, we are honored to have among us Dr. Fu Fangjun, his consultant, and my boss, the head of the colorectal department in Sengkang General Hospital, and is also a great friend and mentor to me. So there's no other person that I'll be more honored to share this morning with. So without further ado, I'd like to invite Dr. Fu to help to deliver the welcome address. Dr. Fu, please.
Thanks very much, Vincent. Let me just share the screen.
Yep, we can see you, Dr. Fu.
Dr. Fu, you're muted.
Can you hear me as well?
Yep, we can hear you as well.
Okay, thank you.
Okay, it gives me a great pleasure to address the Stoma Association, especially on Ostomy Awareness Day. And it's wonderful that despite coming through COVID-19, that we are all still able to gather here, albeit virtually, with patients, nurse specialists, doctors, and members of the Stoma support group to have this webinar today. I've just prepared a few slides just to give some background about Sengkang and Stoma in Singapore. It's a great honor that Sengkang gets to host this year We are the newest public health institution in Singapore. At peak, we'll be about 1,400 beds. And as most of you know, actually most of our patients today were actually our old patients from SGH. So most of the doctors and nurses, we actually came from the unit down in Outram Park. And the function was really to bring the care and service up to the northeast of the country without patients having to travel all the way down south. At the moment, we have a department of 5 consultants, and we've got another associate consultant who's just joined us. The department is now about 2 years old. Lots of things have been happening when we first opened. That's just us in theatre. We have some important people who come and visit us. And not forgetting, we take the care out to the community. So you can see there, Dr. Vincent even goes to the local schools to raise awareness about colorectal cancer and colorectal conditions. But it's not just in Singapore where all our efforts are. We also sort of spread the expertise around the region. So a trip last year where the nurses and ourselves went up to Myanmar, again to partake in the wider perspective of global health and colorectal surgery. So really, when I was looking at the word stoma, as all of you would know, it's a Greek word that comes from, that means mouth. And in Singapore, what more important mouth we have than the mouth of the Singapore River, which is really where Stamford Raffles first set foot, and where Sang Nila Utama came and named Singapore Temasek. And how far we come along from the previous mouth of the Singapore River to what it is today. And the same, I guess, can be said of how stoma as an operation or something that helps our patients has moved on. So I'm sure lots of you know that Napoleon Bonaparte himself had a stoma. And you can see how the devices have moved from the very prehistoric devices. And I'm sure none of our patients today would even fathom the thought of having an appliance like this, to some of the more modern devices where they started having more disposable equipment, two-piece systems. But these are some just prehistoric photos to show you how far we've come along. If you look at what stoma is nowadays, you can see that it's even now fashionable. And I didn't realize that you can even flush, there are even flushable colostomy bags nowadays. And stoma is no longer something to be embarrassed about, something to hold you back. And plenty of examples of people all around the world, who can play rugby, who can take part in boxing matches, and who can even become bodybuilders despite having stoma. So it's no longer something that will hold you back, and people can still proceed with their everyday lives quite well with stoma. So the local scene for stoma support is flourishing. Of course, all around the country, stoma support groups to support patients from every public health institution. Just a little bit about some of the stoma support groups around. And of course, today, the event has been coordinated by the Ostomy Association of Singapore. That's Alil who's here today, who has done more than anyone else really in Singapore in terms of promoting cancer awareness, as well as stoma support. I first met him in GH, where he was a very active member and still continues to today, and I think he should be congratulated. That's him, I think, in Mongolia. So I think from what you can see, stoma has come a long way in Singapore. It's something that doesn't hold people back anymore. The lifestyle around stoma can be very, very fruitful. There's a lot of support around the country. for people or ostomy patients. And I'm pleased to hereby open this event for today. And I'm sure there'll be a very fruitful discussion and sharing today. Today's focus is really about young people with stoma, and it's something that is very close to heart for me. I have lots of young patients here in Sengkang. We see a lot of young cancers, inflammatory bowel disease patients, and sometimes perhaps stoma has greater impact on the lifestyle of younger patients. So hence the focus today is really about stoma and younger patients. But thank you very much.
Yeah. Thank you very much, Dr. Fu.
Thanks.
Okay, we should move on. Now, in order to put an event like this in the seminar, we actually need support from various sources. And we are really grateful for the support of our industry partners who have throughout the years lent their staunch and continued support to us. So today we'll take the opportunity to get each of them to just share short videos on their products and their services. Let us now hear from one of our partners, Ms. Jurina Key from Convatec. Jurina, please.
Thank you, Dr. Vincent. Hi, I'm Jurina from Convatec. Good morning to everyone. Thank you for having us here in this very meaningful event. Taking this opportunity, I would like to share with you a story of Sarah and Charlie to see how Convatec moldable technology has helped to improve their lives.
Hi, I'm Helen and I work for Convatec as a patient.
Jurina, you are cut off, I think.
Sorry, just give me a moment. So sorry everyone for the technical glitch.
No worries, Jurina. Take your time.
Yes.
So sorry, just give me another second.
It's okay. We all have these glitches once in a while.
I'm Sarah and I've been using Convatec Moldable now for 4 years.
My name's Charlie and I've been using Convatec Moldable for about 11 years.
Before I started using Convatec and Moldable, I was using some other products and the adhesive would break down, it would come away. I sort of had sore skin, but I just thought that was normal and you had to sort of tolerate that.
I tried numerous different bags. There's so many different companies out there, so many different products. I could not get any to stay on my skin. I couldn't get them to stick stick for longer than a couple of hours without leaking. Convatec Moldable is so simple to use.
You don't have to cut it. You mold the edges and then it sort of springs back to the exact size of your stoma.
And it becomes so fast. I do it in a few seconds.
It's quite common for my stoma to change in size throughout the day and from day to day, which is normal. You need a really robust product to deal with that kind of situation.
I was actually out for dinner and I had a ball gown dress on, and my stoma had never done this before. It prolapsed basically, which I didn't know what that was at the time. I realised it had moved with the stoma, which was amazing. And when it went back to normal size, it also just moved back, and it still didn't leak. It really tested the pouch and the system.
The moldable product works brilliantly in that situation because A, it's really secure and sticks really well to the skin. Also allows the stoma to change shape, and you still get a really snug fit around the stoma, and that is incredibly important to prevent sort of leaks happening and just to maintain security.
So it's really easy. Step 1, remove the moldable disc from the bag and warm in your hands. Then step 2, after warming, remove the plastic liner marked with 1. Then roll and mold the disc to the size of your stoma. Do not need to stretch, pull it or cut. Step 3, remove the plastic liner marked 2. Then place this side of the moldable disc on the body. Push the rolled moldable technology towards the stoma to ensure a snug fit. And then your final step, and you're done, is remove plastic liner marked 3. Grab your bag. Release liner using the blue tab, then attach the bag to the moldable disc. Bit of a tip for applying it, use the viewing window to make application easier. And you're done.
I use the two-piece Esteem product. When you mold it, you sort of pull the edges back. It just fits perfectly and stays so much more secure. You know, I don't have to worry about the size I've cut the bag, and the fit is then perfect.
I can't even put into words how I felt before I discovered Moldable.
I thought, why have I not been using this for years? Because it genuinely has changed my life.
I sometimes just forget that it's even there.
Actually, a lot of the time, I forget it's there myself. It's incredibly simple, and you know, I wouldn't go back to using a cut bag now because it's just so much easier. You can wear anything you like. No one can even tell you're wearing a stoma bag.
I don't even feel like I have it. I'm just really grateful that Convatec Moldable technology exists.
Okay, Vicia, thank you, and I wish everyone well and have a good day. Over to you, Dr. Tan.
Okay, thanks very much, Jurina. Okay, so I'll move on. I think based on the schedule, I'm supposed to do my talk next. I'll proceed to share screen. Just give me a minute.
Seeing as Vincent gave me too good an introduction earlier, I'm going to introduce Vincent. So Vincent is one of our colorectal consultants here in Sengkang. We both used to work together in Singapore General Hospital, and he was really our star. He was the rising star, and now he's a star. He trained in Singapore, and subsequently he furthered his training in Sydney as well at the Memorial Sloan Kettering Hospital in New York. That is actually probably the most famous cancer center, I feel, in the world. When he went over there, the hospital wanted to keep him there as a consultant, but dutifully he came back to Sengkang. So it's a real honor having him here as part of our team. And over to you, Vincent.
Yeah, thanks, Dr. Fu. You all can see the slides? Can you guys all see the slides? Just to
Yes,
check?
Dr. Tan, we can.
Okay, yeah. So thank you so much, Dr. Fu, for the kind introduction. So colorectal cancer has something that I'm really, really very passionate about. And I think my time overseas has really opened my eyes on the perspective of how people in the West who are generally less conservative approach a stoma. And it's with this kind of renewed foresight and views that I was actually quite happy to be able to give the talk today. and hopefully bring some of the perspectives I have seen in patients overseas to our local population. So the topic I'm given today is on living with a stoma, a concerns of a young ostomate. So this is a brief outline of my talk. I would briefly be introducing what exactly is a stoma, the various types of stoma, why is a stoma needed, but also more pertinently, why are some stomas permanent and some temporary? Next, I will address some of the concerns that patients with a stoma commonly have, especially what can I do if I have a stoma and what can I eat if I have a stoma. And lastly, I'll conclude by mentioning what we can do to help, both from the service in Sengkang General Hospital, but I guess I also speak from healthcare providers at large in Singapore. So what exactly is a stoma? Now, a stoma is essentially an opening on the belly that's connected to either the digestive or the urinary system to allow waste to leave your body. Now, intestinal waste will be what we call feces or poo. And if I were to give you a diagram of how our digestive system functions, whenever we eat, food goes down to the stomach, again goes to the small intestine before it goes to the colon, and then it gets expelled in the anus. So if we were to remove a portion of the intestine and bring it up to the skin, there's a stoma in the small intestine that is commonly called an ileostomy. And if we were to exteriorize an area of the colon, anywhere along the colon, which is where I'm highlighting, up to the skin, that would be called a colostomy. That is a graphical picture of what an ileostomy looks like. Okay, and this is how a colostomy generally looks like. Now, naturally, the sites and the location, whether it's left or right side, can vary. On the left, it tends to be a colostomy. On the right side, depending on whether it's higher or lower, it can be an ileostomy or a colostomy as well. Now, as I mentioned, a stoma also refers to an opening that allows waste from the urinary system to leave the body. And if it is urine that we are talking about, that is commonly referred to as an urostomy instead, which we do see in some patients as well. And commonly, these patients actually are those that have undergone surgery for the bladder. After the bladder, which is the organ that I'm indicating my cursor, is removed, the kidney's urine needs to be stored somewhere. And commonly, surgeons like ourselves would prepare a loop of intestine for the urines from the kidney to be diverted to. And then this is eventually exteriorized to be able to leave the body through the abdominal wall in a stoma called a urostomy. Now, why then is a stoma needed? So there are actually multiple reasons why a stoma needs to be created. I should just highlight on the two most common reasons. Many times it is to protect the connection, or what we call an anastomosis after an operation. So if I were to use cancer as an example, if we have a cancer somewhere in the rectum that needs to be removed, the shaded area in gray represents the area that will be removed by surgeons like myself. And thereafter, we'll try to connect the area here with the remaining part of the rectum together in this way called an anastomosis. Now, for certain anastomosis, we actually want to create a stoma that is before the connection to allow the area of the connection to heal. And once we have checked the connection that it has fully healed, we will then remove the stoma with another surgery. And hence, stomas that are created for this purpose tend to be temporary in nature. Now, another instance when the stoma is needed is for waste removal when the anus has to be removed. Now, our digestive tract expels waste at the anus, and the anus actually has muscles which allow us to voluntarily hold in stools until we are in the toilet. Now, for cancers that are very low down involving the anus per se, any surgery would have to remove the anus to ensure that we take out all the cancer cells. And in these patients, a colostomy is the only way for waste to leave the body. And hence, in these instances, when the anus has already been removed, the stoma is usually a permanent one. Okay, next, I will just address briefly the concerns of a young ostomate. Now, in my initial introduction, I pitched it in a way, what can I do with a stoma and what can I eat with a stoma? But I'm actually going to approach the talk the other way around. I should challenge everyone who is attending today, especially patients with a stoma, to ask yourself, what can't you do and what can't you eat? So the following are the list of things you can't do with a stoma. Okay, this is not a technical glitch because I'm using 2G technology, because the truth is the screen is intentionally left blank because you can do everything with a stoma. If Napoleon can go to war with a stoma shouldn't stop any of patients from resuming their normal lives before surgery. Now, patients with a stoma can do things like flying. Now, naturally, for long-haul flights, you may need to have a travel bag whereby you have a supplies and spare drop wipes and change necessary to facilitate your bag changes. Patients with a stoma can exercise. They can lift heavy weights, work out in the gym, just like these two extremely fit individuals are demonstrating in the picture. They can also wear fancy gear like Lululemon, go for yoga, Pilates, running. So none of the stoma should restrict any of these activities at all. The only advice I have for patients who want to embark on heavy weightlifting exercise or straining activities will perhaps to consider getting a hernia support garment. These are actually garments which help to distribute the straining forces evenly throughout your belly, just so that there is no force that's directed just around the stoma to prevent you from getting a hernia. Patients with a stoma can swim. Many of the stoma appliances tend to seal and are even waterproof, as clearly demonstrated in the picture here. And for those who are a little bit shy and don't really want to appear in the public eye with a visible stoma bag, there are actually various appliances such as stoma belts that are available, such as this for males, and even two-piece swimwear in females, whereby matching belts together with your swimsuit can be available just so that you don't feel so exposed with a stoma bag hanging around. Patients with a stoma can also do contact activities. Okay, this illustrates a patient from the States who is actually an avid surfer. If you scrutinize here on the right lower side of the belly, she actually has a stoma bag. Okay, but she has resumed surfing. Okay, even though she has a stoma in place. Now, so contact sports and activities are definitely possible. Some modifications may be required in the sense that you may want to consider getting something called a stoma guard, which is essentially a plastic piece that helps to protect the stoma just in case it gets traumatized during contact activities. But a stoma per se really doesn't stop you from doing things like rugby, even American football, taekwondo, judo, or whatever you can mention. Okay, now I should then go through the list of things that a patient can't eat with a stoma. And the list is as follows. So yes, it is blank again. And this is intentional because the truth is you can eat everything with a stoma in place. Now hang on a minute, okay? You're going to say, no, that's not true. My uncles, aunties, sisters, cousin who has a stoma says that you're not allowed to eat peas, for example, because it gives you too much gas. Or you can say your friends, fathers, mothers, grandmothers, second cousin who has a stoma says that you're not supposed to take fruits and vegetables because it can cause the stoma to block off. But the truth is, you can eat everything, be it roti prata, char kway teow, okay, and even nasi padang. And the reason why I say so is that every patient is different, all right? Peas that cause gas in one patient may not necessarily cause gas for yourself. And the truth is, living with a stoma, as in many things in life, is like trial and error, all right? It takes a period of time for you to figure out what are the foods that will cause certain problems, be it gas, liquid stools, constipation, etc. And then make some modifications such that you can resume your normal life as per it is prior to surgery. Now, as I mentioned, some modifications may be necessary. Consistently after surgery, what we will recommend is to adhere to a low fiber diet for the next 6 to 8 weeks. The reason being that sometimes in the immediate few weeks after surgery, the stoma opening in the skin can be a little bit tight. And if you take too much fiber, it may make it a little bit difficult for the stoma to handle, and hence risk of blockage can happen. But honestly, after the 8 weeks mark, there is really no restriction on what you can or cannot eat. But then you do make modifications appropriately. If your stoma output is too watery, then consider taking more things like white rice, pasta, or potatoes without skin to try to bulk up the stools. If you find that the output is too hard, then take more fruits, vegetables, or fruit juice that will help to soften the stools. If you think there's too much wind, then consider things like taking less beans, cabbage, cauliflower, or fizzy drinks. And if you think that there is a smell from the stoma, then consider cutting down on cabbage, eggs, fish, garlic, and onion, etc. Now, the topic I have today is on living with a stoma, with particularly concerns in the young. So while I understand that we are a conservative society, I think it's important that I do mention briefly about living with a stoma and intimacy per se. And I think there's no better way to start by dispelling common myths and to correct the myths by letting you all know the truth. So the first myth that patients with stoma commonly have will be that having sexual intercourse with my partner may potentially spread cancer to my partner. Now that's totally wrong, and that's not true, because we all know that colorectal cancer, which is the reason why most stomas are created per se, does not spread by sexual contact. In fact, for diseases like Crohn's disease or ulcerative colitis, which tends to happen in patients that also require a stoma as well, all these are not transmitted via sexual contact. The second myth that patients commonly have is that body movements during sexual intercourse can hurt or damage my stoma. The truth is that close body contact and movement during usual sexual intercourse actually should not injure the stoma in any way. And the last myth that I really want to dispel would be the fact that it is impossible to look attractive with a stoma. And for that, I shall not speak, but I shall let you all see what I think is the truth. So the following are images that I managed to obtain of stoma patients. All of them are in relatively young patients, but a lot of them in foreign countries whereby they have a more positive outlook in life. And you can see that they have lots of self-confidence about their own body image. Okay, of note, the patient on the left, this hung here, was actually the wound ostomy nurse's first choice for the guest speaker today. I think Suhaida and her team really wanted him to be speaking at the event today, hopefully without his shirt on. But they couldn't get him, so as scant consolation, I am giving the talk instead, so I apologize for that in advance. But the truth is, you can look attractive with a stoma as well. Now, as in many things in life, a cup half full of water can be regarded as half full, or it can be regarded as half empty. And it's really the perspective of how we view it that really matters. What we think may be something that people mind a lot, or there's something that people will stare a lot, may not necessarily be a big deal to the people around you. So do bear that in mind. And as I come towards the end of my talk, I would just like to share some anecdotes from patients with a stoma that I have come across. Now, this patient who had a stoma created for cancer and is a permanent stoma actually has this outlook that says that an ostomy isn't a reminder of what you have suffered, but it actually means that you have survived everything and you're still here. And with years, when stomas become more and more commonplace, and that is actually more and more accepted and commonplace in our society, step by step, day by day, the stigma about a stoma is actually taking a backseat to the reality that life with a stoma can be just as good, if not better, than life without one. Now, don't get me wrong, I'm really not trying to trivialize having a stoma. Now, we know that it is life-changing and there are some modifications that need to be taken. But the truth is, difficult roads often lead to beautiful destinations. And it may be a long hike up, but for all you know, once you pass the turn, there's a rainbow at the horizon. And the most important thing is that while the road may have some bumps along the way, people like myself, like the team in all the public healthcare sectors and all the doctors and OAS are actually here to help to make the journey a smooth and easy one as possible. So for ourselves in Sengkang General Hospital, we have a WOCN team of 5 angels that I have here. But I think what is really, really unique is that we work really, really closely with each other. And when you approach any of the WOCN nurses in Sengkang General Hospital, you are actually also engaging us, a group of surgeons who work closely hand in hand with them. So we commonly ask the WOCN team in SKH to help out with our stomas and wound issues that we have. But we also understand that sometimes there are certain problems or issues with the stomas that can only be solved with surgical intervention. And that's when our role as surgeons come in. So in Sengkang General Hospital, we are very happy to help look after all patients with a stoma. Okay, we don't promise you a solution to all your problems, but what we can promise you is that we'll do our very best, be it from our WOCN team or from all the surgeons that are in the department, to chip in whatever way we can to make the journey as smooth and as with little inconvenience as possible, so that everyone can appreciate the rainbow at the end of the horizon of this difficult journey. Okay, with that, I thank everyone for your attention. Thank you very much. Okay, so I'm done with my talk. So I think I am going to invite another of our industry partners and supporters, Coloplast, to now share their message. May I please invite Shuling? Or I think Elio is going to share the video from Coloplast. Elio, please.
Yeah, hi everyone. This is Shuling from Coloplast. So Ili will be helping us to share a video on what Coloplast actually believes in for patient care and the story of how a young ostomy, Stina, and how Coloplast actually helped her return to her normal activities. Thank you, Ilio.
My whole life, I've been able to hide my sickness and my disease, but now I thought that everyone will know, everyone will see it. I have to change so many things about my life, and what will people think of me? When the doctor told me that I was getting a stoma because my large intestine was in such bad shape, it felt like a hit in the gut. But then I started to feel hope again. Maybe this will change my whole situation, and maybe I will have the strength to go to the park with my daughter, and all these thoughts of hope came into me, and I felt, okay, let's do this. It really helped me to talk about this, to talk about my stoma online. And at the same time, I could see that it helped others as well. I was afraid for uneducated people telling me stuff or telling my loved ones stuff that's not true. So that triggered me to tell my story. I want to show people that I'm a survivor and there's nothing to be ashamed of.
Okay, thank you very much. Now, next, we have Integra Healthcare. They are the latest industry partners to come on board, and we are very grateful to them for bringing in products that can help to improve the quality of life for all our ostomates. Let's hear now from Ms. Lina Chua from Integra. Lina, please.
Thank you, Vincent, for the introduction. Morning, everyone. My name is Lina from Integra. We're very proud to be invited actually to partner OAS in this Ostomy Day. So if you allow me, I have a few slides to share. Can you see my screen?
Yes, Lina.
Okay. So, I mean, what I would like to introduce you today is the Omnigon support garment. And I believe just now, Vincent had also briefly mentioned about having to lead, being able to lead a normal life, and there's nothing you cannot do. So as such, one of the products that could actually be very helpful for the patients are the support garments. So I think we have seen, and evidence have shown that around 42% of the patients actually do experience, do come down with parastoma hernias during the first year of the surgery. Now this seems pretty high. But so then what do we do about that? There are also studies to show that there are ways to reduce all this hernia incidences in patients who had undergone stoma surgeries. And one of the recommendations is actually to have patients put on the support garments or belt, along with all the rest of the exercise that will be recommended after the surgery. And these patients were actually monitored six months, 9 months, and 12 months after surgery. And what happened was they actually see a reduction of hernia prevention down to 15%. So this, I believe, is good news for patients, because you really don't have to live with a hernia surrounding parastoma, surrounding your stoma. So then there comes another contention. I mean, you will see lots of stoma support garments that are available in the market. So there are those that comes with holes, and there are those that comes without holes. So what Omnigon has are stoma belts and stoma garments without holes. And there is a reason behind why the stoma belts and garments are developed without the holes. Simply because the muscles surrounding the stoma that have been created needs to be supported. In a garment that has a hole, the support is weak around the stoma. So thus, Omnigon comes up with garments and support belts that doesn't have holes. But having said that, the garments will allow discharge outputs as well. So how is this being managed? Then that's where the partnering between the patients, the surgeons, the caregivers, and the nurses will come in, because these belts will need to be measured appropriately so that you go back with the appropriate belts, the appropriate size belts and the appropriate size garments. So there are different support, different level of support for the for patients. So depending on the type of activities that patients wants to undertake. So it ranges from moderate support to intermediate support to firm support. So obviously, if you engage in more severe activities, let's say weightlifting, you will probably require a firm support versus, like, you know, you just do a simple walk in the park and all that. So then you will only require moderate level of support. So speak to your nurses, speak to your surgeons, and speak to your caregivers about the level of or the type of support that you need, and they will be able to recommend you the appropriate type of garments in order to support. So in conjunction with the Ostomy Day, we are actually running a 10% discount off all the garments that are available. So our garments are available at Sozo Wound and Stoma Care, and they are located at Novena. So during the period of October, if you head down to Sozo, you will be able to see, you will be able to obtain this different types of garments, and there is a 10% discount to the garments that you will purchase from there. So to end this presentation, I think we all want, we know that prevention is better than cure. So the general advice preoperatively is be as fit as possible. Try to strengthen your abdominal muscles and do pelvic floor exercises. If you're smoking, stop smoking. It's also important to learn how to get out of bed properly after surgery, but I believe all this counseling will be done by your nurses and your caregivers and surgeons as well. And what is important is measure for light abdominal support garment after when you just have your surgery. And post-operatively, to support the abdomen as much as possible. And like said before, it is important that you get out of bed properly so that you don't strain, you don't put too much strain on the muscles surrounding the stoma. And if there's pain, then you take regular painkillers as prescribed by your doctors. Now, the notion of, you know, not trying to stay in bed, stay immobile is no longer encouraged. So it is actually encouraged that you start to do abdominal exercises upon discharge from the hospital. Do simple walks, but avoid lifting heavy stuff for 3 months. But if you have to, lift them correctly and put on the right garment, the support garment, in order to support you through your journey. So all this, I believe your nurses and your caregivers will be in a better position to counsel. And with that, I thank you. So over to you, Alil or Vincent.
Lena, can I ask you a question just on behalf of the patients? We have over 100 participants.
Yes.
So I'm sure that was a really nice talk, and I'm sure a lot of them would be interested in obtaining a belt. Would you advise them to see the stoma nurse first and then get a recommendation to then go to Novena to buy, or do they just go straight to your shop?
Well, actually, so we don't, we recommend you speak to your nurses first. They will be in the best position to take measurements for you, to recommend you the right type of garments. But having said that, Sozo is also able to assist in performing the activities to do the right sizing. I think what's important is for the patients to speak to their immediate caregivers, to their stoma nurses first. And then from there, if they need, or if the recommendation is, let's say, to use a belt over, let's say, an underpant, then, I mean, that recommendation should come from the nurses. And then where you can obtain the products is head down to Sozo. We have different types of garments that are available there.
Okay, so first port of call, the stoma nurse.
Yes.
Okay, thank you.
Okay. Thank you very much, Lena. Thank you. Okay, I think we are about to come to so for me personally, the sharing sessions, which to me are actually the highlights of today's events. And I think the two sharers we have are actually the stars of today's show. Now, in our population, colorectal cancer remains the main reason why patients require a stoma. And I think in recent years, we have seen an exponential increase in colorectal cancer that's diagnosed among the younger patients. As you all know, the actor Chadwick Boseman, who acted as the Black Panther in the Marvel series, was recently also found that he actually had colorectal cancer and unfortunately demised at the age of 37. So it is really not uncommon these days for young patients to have a stoma created, some of which are really permanent in nature. And today's theme is actually young and living with a stoma. So we are really, really fortunate to have a very special guest with us today. She has kindly agreed to share with us her journey and how she's living a full and active life with a stoma. So may I please invite Miss Debbie Cole to do her sharing, please. Debbie, I'll hand over to you.
Hi, thanks, Dr. Tan. Hi, everyone. I'm Debbie. Before I start, I really want to thank the organizer for inviting me, for giving me this opportunity to share my journey with all of you. So I would like to share my PowerPoint slides.
Debbie, shall I share or you want to share?
Would it be possible for you to?
Yes,
I can try sharing myself.
Okay, great.
Thank you. Can you see the slides?
Yeah, we can.
All right. Okay. Yeah, I'm actually 38 years old. I'm actually an educator, and I'm teaching in primary school in the east side of Singapore. So just a very brief something about myself is that I really enjoy doing spa, body massage, and traveling, swimming, and sunbathing in my two-piece by the pool with a good group. So this is a little life enjoyment that I have always been enjoying all since I was young. And lastly, I really love food. I love eating. I'm a foodie. But just some health history about myself and where I come from. So I was diagnosed with thyroid cancer when I was in Set 2. And then I also have family history of colon cancer and underwent colorectal surgery to remove my large intestine right after my A-level. And that was in 2001. And recently, about 2 years ago, I was diagnosed with anus cancer. So it was on 17 December 2018 that, was the complete darkness of my life when my colorectal surgeon, Prof. Chu, actually told me a string of devastating news to my husband and myself. So at that time, I was really in a very utter despair and disbelief that, and I could not reconcile with the fact that at such a young age, I have to, face the fact that I have to live my whole life with a permanent stoma. And at that time, my husband and I actually wanted to start our family. So imagine it's like our dream just changed overnight. I was just destroyed overnight. So it took me a few days to accept the reality with very great sadness. But having been through so many obstacles in my life, I was really able to forge on ahead very courageously. And I know that it was very important that I should start embracing life, with a stoma, no matter how. So the support and provided by Nurse Suhaida and the other stoma care nurses at that time have been very, very useful and helpful for me. They're able to address a lot of my concern, fear, and their assurance have really, seen me through as I prepare myself for a lifelong usage of stoma. So after my surgery on the 23rd January last year, day by day, I slowly began to embrace my life with stoma. And slowly, I began to get very excited and started ordering and exploring different brands of stoma beds and accessories, wanting to find the most suitable, effective, and cost-saving stoma for myself, and one that allows me to participate in activities that I enjoyed doing all these years, comfortably while wearing this stoma bed. So having to live my remaining life with a stoma isn't as daunting as I first initially thought it would be. So it has been 21 months since my surgery, and I came to realization that being positive and optimistic every day is very crucial for me, because it really helps to empower me to become a happier and stronger ostomate. So how my life has changed with a stoma? To be very honest, right now, I don't think it really has changed much for me. Life has been quite normal, like what Dr. Tan has assured us. And I don't think there's much change, but I still can swim. I still can do my spa treatment, traveling, jogging, etc. like a normal person. But it's just that I probably don't have the courage at the moment to wear a two-piece right now. And small inconveniences like I will need to time my meal and the activities I would like to do. Because I wouldn't want to swim or lie face down for my body massage where with my stomach bag filled with output after my meals. And when I jog, I will tend to wear a circle with a stomach belt. And right now, every day, I will just bring along just a small empty bottle in my handbag to fill it up with water so that I can rinse my stomach bag clean. And traveling, I've tried traveling to Malacca with my husband and some friends. And it's actually more of a breeze right now for me as compared to the past when I do my traveling. As I don't have to frequent the washroom as often as I did in the past without a large intestine. So what about work? At work and when I go out to dine, right? I also don't face much of the issue because I work a lot in school and I have to oversee quite a number of school program as a level head in the department. So my stomach bag actually has not much of the hinder from my work. In fact, a lot of my school leaders and my colleagues knows about my stomach, but it's precisely having this stomach that I'm actually more determined to excel in my job. And I want to be the actual proof, to people around me that having a stomach is actually not a disability. It's nothing to be shameful about, but rather it didn't diminish me. It inspired me to be more inspiring as an individual. So the only difference I would try to do at work is, I will try to avoid wearing white top right now, or tight-fitting clothes, because the portion where the ventilator is there, it tends to turn yellowish a little bit. So that's why my reason for not wearing the white tops at the moment. And I also, depending on the food I take, some food tends to produce more gas, which will cause my stomach bag to inflate. And like Dr. Tan mentioned earlier just now, virtually we can just eat anything. But for my personal experience is I can't take all types of mushrooms because I've suffered 2 blockages this year alone. So I just stopped taking that type of food. And I also avoid consuming fruits and fruit juices when I'm dining outside because like for instance at the hawker center, I used to drink fruit juices or sugar cane juice. So once I finish the whole glass of that juice, literally it will just come out through my stomach bag quite immediately. So my stomach bag will actually be filled with water, very heavy and very inflated. So I really have to run to the washroom quite immediately. So that's why I tend not to drink all these fluids when I'm outside. But other than that, if I could drink plain water and eat my normal food when I'm outside, in fact, I can just go on for hours chatting with my friends and family at the tables. I don't even have to run to the washroom. So that is actually quite a breeze for me as compared to the past. So I would be lying if I say that there's no cons to having a stomach but I feel that this little inconvenience is actually not too major to my life. But I do worry about the additional expenses because when I'm old or when I retire, because I change my stomach bag. It's a 2-piece stomach bag I'm wearing every day, and I change it like once a week or once every fortnight if I'm lucky. So this costs about, plus the accessories cost about $14 per week. It's not a lot, but it's something that I need to set aside when I'm old and I'm not working. And the next cons that I thought that I would like to share with some people is that changing stomach bag at the wrong time can be very tedious for me, and it is inevitable that sometimes negative thoughts will creep in. And for a moment, I can be thinking like, I really have to face this, the chore of changing the stomach bag every week, every fortnight for the rest of my life until I pass on. That's why I really feel that, I really need to live my life with a lot of positivity and optimism every day. Like I mentioned earlier, some of the cons that I face, like inflated stomach bags and sometimes funny sounds by releasing the air through the stomach, emitting when I'm in a Grab, public transport, it can be quite embarrassing at times. But since then, I've learned to adapt and I find it kind of cute, the sound that it produces. So these are the little things that I see things in a positive light to keep myself going and happy. And lastly is I still miss wearing my 2-piece swimwear, and something that I still need to try to pluck out the courage to, or to try using that in time to come. And also certain types of clothing I have not got to wearing it yet. So and it's also sometimes it's a bit sad because I have to think and plan ahead. Sometimes if I want to go for my massage, I have to not eat my meal first, I have to eat real early, and this kind of the adjustment I have to make in my life. But thinking back, between survival and vanity or small little inconveniences in my life, I will still choose survival, and I would, without hesitation, and I will continue to make the best out of my own situation. And I realized that rather than feeling depressed or sorry for myself, I think staying positive and focusing on the benefits that I have received since I have my stoma makes me more appreciative, thankful for what I have right now. And I know, to be very honest, I really think that I really now enjoy a better quality of life, especially when I'm at work, out dining with friends and relatives, or traveling overseas. In the past, I'm not sure how many of you experienced the life I had before, but without intestine, it's actually quite a help for me because every time when I have my meals, I really need to run to the toilet to pass motion. So there will be times when I'm in public areas, and we all know that public toilets can be quite nightmarish. Long queues, no toilet paper, dirty toilet bowls. All these are the torture that I was facing at that time. Sometimes when we have to rush back to the hotel when we are overseas, or we have to rush back home after our meals, it really, I guess it really the person who really affected, I guess, is my husband. So I to a certain extent, I think it really affects his because he's going out with friends, and we have to rush back home. It's really a spoiler for him. So certainly now with a stoma, I really feel that my life is so much easier for myself and for the people around me who really love me. And I just want to end off that, being an stomach, living our life every day with a lot of positivity and optimism is very, very crucial. And it really brings out the happiness and gratitude in myself, and live life fulfilling and meaningfully, so that we never have much time to our energy to even feel sorry for ourselves is really very important. So I hope that my sharing today can really be helpful to you in some way or another. So really thank you so much. Yeah, I shall end here.
Yeah. Thank you so much, Debbie, for sharing. I mean, it's really an inspiring story. I thank you for your courage, and also your husband, who I presume is the person at your side just now.
Yes.
So I mean, it's a fantastic story, and which is why I say you guys are really, really the highlight of the show today. But I think most importantly, for you to have the courage and graciousness to share your journey with all of us today, it was really invaluable. So we shall move on. Before we go on to the next item in the program, which is our last sharing session, we will have another vendor sharing first before we will move on to the final sharing session today. So I would like to now invite Ms. Tricia So from another one of our industry partners, Vinda Singapore, to share her message. Tricia, please.
Hi, a very good afternoon to all of you. Okay, thanks for the introduction, Dr. Vincent. I will share a short video clip followed by a short presentation. Hold on a minute. Can y'all see the video? Oh.
No, we can't see anything yet.
Okay. Can y'all see?
Yeah. The sound is very soft though.
Okay. Better?
Can't really hear the sound.
Okay, let me see. Maybe I will replay it. Better now?
No sound, I think.
You sure there's no sound? Maybe you need to check your sharing options.
Oh, okay. So, there's no sound, huh? Um, there's no sound or it's very soft?
No sound. We can't hear anything at all.
Oh, okay. In that case, perhaps I will just go into my slide presentation.
Sure, no issues.
Okay. Can you see my slide?
Yep.
Yeah.
Okay. So I'm representing Vinda Singapore. Basically, we are dealing with hygiene product and services. Some of our product is as what is shown in the slide: diapers, Tena, Vinda paper, Tempo paper, Libres. Talk is actually a service commercial tissue to the business to business, and we have some wound care product as well. So let me focus on Tena. Tena has been in the market for almost close to 50 years. So being the understanding specialist in continence management, we have a comprehensive range of product for urinary or fecal incontinence in different formats. As shown in the picture, we have light continence product for bladder weakness. We have tape diaper, or we have pants diaper of different absorbency for different needs, cater to different needs. And of course, we have some accessories like wash cream, wet wipes, barrier cream, zinc cream, underpad for individuals' needs as well. Below here is a website, and we have our Facebook page. You may actually call up this hotline to request for sample if you need it. So that is about all of my sharing. Thanks, everyone. Dr. Vincent, over to you.
Okay, thank you very much, Trisha. Yeah, more often than not, we tend to focus our attention on the patient, but little do we realize that the extremely important role that caregivers actually play. Now, they nurse the patient back to health, and in many cases help them manage their condition on a daily basis to maximize their quality of life. So we have the privilege today of hearing from one such patient who will be sharing her caregiver journey and challenges with us. Please welcome Ms. Fong Lam. Fong Lam, I'll hand it over to you.
Everybody, hi, can you hear me clearly?
Yes, we can.
Okay, good. I don't need this. All right, so yeah, my name is Fong Lam, and this is my hubby, Sean. Yeah, so thank you very much for having me as well as him on this for this sharing this session today. All right, so thank you for Dr. Tan mentioned that yes, a lot on the patient. So me as a caregiver, we actually focus on the patient as well, right? So why? Okay, let me give you just some background story. The first thing I said to him, there's blood. It's not normal. All right, I actually spotted him having some blood in the toilet bowl after he had done his business. So you just have this conversation. It's not for me. So could it be from you? He said, yeah, he noticed there's a couple of days or weeks that he's spotted blood. So he decided, yeah, it's time to do a checkup because for my case, my father is actually a close survivor for more than coming to 30 years. Yeah, 30 years. So maybe I do know some background of it, but of course I didn't expect my hubby to eventually also got this this same situation. He was only 39. He was only 39 when he was being diagnosed. Yeah, right. And of course, we are a young family then, even now still quite young. We have two kids. They are at that time a 9-year-old boy and a 7-year-old girl. So see that they are still in lower primary, very little kids who may not even understand what is happening, right? But we are very honest with the kids. We told them exactly what was happening because just be honest so that they know what they should do at home or what they should do in school and what how to also show care and concern, right? So for me, my role is always a mother, a wife, and now extra role as a caregiver. And we are actually in the same industry, but in the fitness industry. So we are working in the same gym, and he is also a personal trainer. He is also a personal trainer. Is it better now? Can you hear me clearly? I'll go closer. So a lot of people is thinking, hey, how can that happen to Sean? He really is clean. He's very healthy. He works out very often, right? But I don't understand the fact is like self-denial. Okay, Debbie was sharing. It's true, like how could it happen? But I think very quickly move on to what to do next. So together we agree, look forward, look for solution. Okay, and we take all the suggestions one by one, like go for your remover. Okay, go for the test, go for everything, go for the remover of the tumor, right? So everything was in place. So being there for him, I would say I have to do my teach out class because the fact is that we still need to have the income. And some of the program is the same program I'm teaching. So I have to teach my own program on top of that, his program. So my journey for that time was teaching the gym, going hospital as much as possible, right? How do we get the energy? How do we get the support? Thank God, our family are very supportive. I have my parents, or even his parents coming over to jaga, okay, in the case means taking care of the kids, all right, ensuring that they do what they need to do. So my role was really to be in school. No, not in school. Okay, sorry, maybe I have to put this in because the connection ran off. Okay, yes, and then I will have to, yes, okay, then I'll have to quickly settle everything that I should. All right. Okay, good. Yeah. Is also what to cook. So we also have a lot. Can you hear me better now? Yeah, good. Thank you. So we ideas what to cook, and we have friends who bought us a recipe book. Friends to have people, even friends from the gym, my family members helping in as well. Okay, another thing as a caregiver that I have to be a bit mindful of is the chemo cycle. The chemo cycle, right? Like we know that during the entire chemo cycle, there are days that he may feel a little bit that he feel good, and on the good days, okay, he actually go to the gym as well. Right, just go for a walk in the park, and he always believed that every workout is a blessing. Every walk is a blessing. So for me to stay positive is also for him to stay very positive. So we have this agreement that we're going to go through this together. All right, and also financial concern. I mean, that's also a very big concern. Being a young family, you have kids to take care. I would say we also consider sandwich generation. We also have parents as well. All right, so the good thing is that I would say we have insurance. So okay, I'm not selling anything, but insurance is really very important to make sure you're really secure. So that is why I would say it's not such a, we are able to manage through with that. Okay, and I would say I'm the one who changed his stoma. Yeah, I was 6 months. Okay, for Sean's situation, he has a temporary stoma for 6 months. It's 6 months. Okay, so throughout was actually so I think so have to clean and go to the process for him. and I think the important story I need to get right sharing and thank you. So if you can see. Okay, hold on. Right. Okay. Can you hear me clearly now?
Yeah, we can hear you now. Yep.
I think, Fong, maybe you can disconnect video. I think then the audio will be better because the video uses up a lot of bandwidth.
Okay, sorry, can you hear me clearly now?
Yes.
Can you hear me clearly now?
Yes.
Yes, we can.
Okay, good. So I'm saying that whatever happens, stay strong together, having the strong faith and push through everything. Really cherish every moment, right? Be thankful. It's another new life, but it can be a beautiful one. Anything to add on? Okay, I'm so sorry for the poor connection. And stay strong, everybody. Thank you.
Dr. Tan, just before you carry on, may I just say that we will conduct a separate interview with Fong to share her journey, and then we put it up on our website also so that you can listen to a proper sharing later on. Thank you, Fong, for sharing that.
Yeah, thank you, Fong, for your valuable insight on the caregiver's journey and challenges. I think it's now time for our panel discussion. I think we may have overran by a little bit, so I think we have about 10 minutes, if I'm not wrong. Now, if you have any questions, please type them in the Q&A section, and then we will direct it to one of the panelists. I will be both a panelist and the moderator for this session. It is my pleasure to introduce the other panelists now. We have Miss Jacqueline Teo from Sengkang General Hospitals, one of our WOCN nurses. You around, Jacqueline? And then?
Yeah, hello.
Okay, we have Miss Debbie Cole, who is around, which we shared her inspirational and fantastic journey. We have Miss Fong Lam, yeah, she's there now, who just shared her caregiver journey, and we have Elio, right, who's online now. Okay, so please send in your questions via the Q&A tab, and then we will try to get as many answered as we can with the time available.
Vincent, I was going to say, although when Fong was sharing, there was a little bit of signal interference.
Yeah.
You can just see, just from the look on her face and a big smile, that life still goes on as a stoma patient and support giver, really.
Mm-hmm.
It still carries on happy as much as you will make it to be. Yeah.
Yeah, absolutely.
I also like to add that Sean, Fong's husband, is my personal trainer. And I know the both of them very well, and they're an awesome couple and really living life to the fullest. And they have two really wonderful, talented kids who are inspiring in their own way. So yeah, well done, Fong, and thanks a lot for sharing your journey with us here.
Okay, I see someone wrote Dr. Fu or Dr. Vincent. I think Kwak. Okay, someone is asking, how often is the stoma bag needed to change after surgery? Okay, so maybe I will just briefly answer that. Okay, I think the question is, it really depends. Okay, so I'm answering David's question first. Is that how often is the stoma bag needed to change after surgery? So to answer your question, it really depends. Now, if you're talking about the immediate 1 or 2 days after surgery, most of the time there isn't much output yet. So I don't really think you really need to empty it that much. But when the output starts, then I think the first step is learning how to empty it, and then thereafter is changing the bag, which can vary depending on how well it is fitted. As a rough gauge, I tend to tell my patients about 2 or 3 times a week maybe I should direct to the in-house experts, Elio, Jacqueline, Sister Ong. Maybe you all want to contribute?
Yeah, I was going to say we should ask Sister Ong. Not just because she started probably nursing before we were born, but as a tribute to the grandmaster herself, Sister Ong from GH.
Yeah.
Chuing, you there? You must unmute yourself, Chuing.
Yes, Dr. Fu, I'm here. Okay, I mean, how long the stoma bag need to be changed? It depends on the type of bag that we put it in. Immediate surgery, usually, as Dr. Winston said, there's not much output, so it can be changed between 3 to 5 days when the stoma CGT can be carried out. Now, if the patient is wearing a one piece, recommended is the most is 3 to 5 days. Depends on whether it's ileostomy or colostomy. If it's a two-piece system, it's ranging from 5 to 7 days. I always tell the patient, go for your feeling. If you feel itchy, pain, or stinking pain, that is a sign that you must change your wafer. But of course, we do know that some patients, they want to save cost, they try to stretch the wafer duration long time. But if your skin is very sensitive, fragile, then we don't recommend you to stretch your wafer so long. Always go for the recommended wear time that the company recommend. Yeah. Over to Vincent.
Okay, so thanks, Sister Ong. Okay, so I think there's another question. Kwak has asked, how long can, I guess what he's trying to say is how long can a colorectal cancer patient survive? So it's very variable. Okay, the survival for colorectal cancer is dependent on the stage of diagnosis. In the early stages, when it's stage 1 cancer, whereby there is no spread to the lymph nodes at all, you're looking at excellent survival. I mean, the statistics quoted is that more than 90 to 95% even will survive beyond 5 years. Naturally, as the stage increases, the survival rates are slightly lower. And also you have to look at other factors as well. Like if you're stage 4, is stage 4 to where? Is it how much disease there is? So it's very, very difficult to generalize a number. All right. Okay, I have...
And Vincent, maybe I can add that maybe with the message really to all out there is that the earlier you detect the tumor, the better. So as Vincent was saying, survival depends on stage. And of course, if one is detected at a very early stage, or even better, even before the tumor has, it become malignant, when it's still at the stage of the polyp, then the survival can be normal as per anyone else in the country. So definitely, if you're having any symptoms, as Fong was sharing earlier, do not be afraid. Go and see the polyclinic, the GP, and come to hospital to get checked out. Prevention, of course, better than cure. If you have, so I suppose most of the people here today attending are ostomates. So if you are already yourself someone who has had colorectal cancer, do advise your siblings, relatives, people nearest and dearest to you, or even people at work, if symptoms are above the age of 50, to come forward for screening.
Yeah.
Okay, we have another question.
Just to add to Dr. Fu's comments, there's free screening, colorectal screening available at the Singapore Cancer Society. If you're above 50, you can just collect the fit kit from some of the Guardian pharmacies as well. Or you can drop them a line, or you can even get into contact with me, and I can tell you how to get colorectal screening, which is subsidized by the Singapore Cancer Society, and you don't have to pay anything. Yeah. Sorry, Dr. Tan, over to you.
Yeah. Okay, I think there's another question here from Sharon. So Sharon is asking, how do we improve watery stoma output every 2 hours? Is there any kinds of food to consume? Also, the mother is asking why there are different types of texture, sometimes wet, watery, or pasty in a day, and how do we manage that? Jacqueline, are you there?
Jacqueline,
Yes.
MIA.
Okay, maybe Jacqueline, do you want to help to answer this question?
Okay, for watery, okay, so Sharon, I believe your mom is ileostomy. Am I correct? So I think for ileostomy, right, basically it will be watery to pasty stools. So what we normally recommend is to take starchy food such as potatoes, rice, so that you help to kick up the stools to make it more pasty. So the consistency of the motion, I think it largely depends whether patient also taking a lot of fluids. So we have to check with your mom whether is she taking a lot of fluids and how much is a lot, whether is it more than 800 ml a day or slightly less than that. If it's more than 800 ml, sometimes what we're afraid of is a high stoma output, and in which we have to monitor and might have to start on anti-diarrhea medicine. Anything Sister Ong can add on?
I just saw Sharon has replied. The mom is on radiotherapy and oral chemo. So it is naturally expected, because due to the side effect of RT and oral chemo, that the mother may have watery stool. So my advice is to monitor the output. Anything more than 800 ml, speak back to the chemo doctor or the radiotherapy doctor. They may start her on what we call anti-diarrhea pill like loperamide, to titrate the output, to decrease the output. If not, she will get dehydrated. So my advice for Sharon is do monitor the output and feedback to the chemo doctor. Yeah.
Okay, thank you, Sister Ong. Thank you, Jacqueline.
We've got one question from the chat group from Wendy Pua. For how long will the patient stop passing out from her own bowel after surgery, and it will be passed out from the stoma completely? That's the question.
Okay, thanks, Wendy, for the question. Now, it's very, very difficult to give you an answer unless we really know the clinical situation behind what this is. Now, by what you're telling me probably means that the normal bowel and the anus structure is all still intact and that there's a stoma in place. Then it really depends on why the stoma is created and whether things like the tumor and all that is still in place, or if you're talking about after surgery and that the tumor has been removed and it's just a stoma that is temporary before it gets put back. In that instance, if you're talking about stoma for after surgery that we are using to rest the connection that I mentioned in my talk, most of the output will be coming out from the stoma. You may still have output coming out from the anus as per normal, but with time that tends to reduce. But you have to bear in mind that our normal colon produces discharge and mucus. So it is really not surprising or uncommon for you to have mucus or even sometimes some old stools that pass out through your end in addition to what you're having from the stoma, right?
Another two very interesting questions, and I think they are kind of related to each other from two other patients, really about embarrassing noises from the stoma. Presumably this is passing flatus lah. That was from one patient, and another patient also was talking about when he travels, whether there will be a pressure effect in the stoma. That would obviously may give out noises or even explode.
Okay.
So in terms of embarrassing noises, maybe this would be a good question for Suhaida. Suhaida, are you there?
Yes, I'm here.
Suhaida, how do we cope with, or how do we do away with these sort of problems? I'm sure it's a very, it's a real life problem, isn't it?
Okay. So Aida, you need to turn off the other mic or move further away.
Sister Ong needs to mute. Yeah. Not Suhaida mute. Sister Ong mute.
Okay, sorry. So you need to down your volume.
No, you.
Sorry, we are in the same room.
Yeah, you got to mute the other PC. Don't down the volume. Completely mute, then maybe you don't have echo. Yeah.
All right. So passing out through the anus.
Why don't you mute yours, Suhaida, and then you join Chu Ing? Okay, chewing is muted has already. Okay, you can start again, sorry.
All right, so again. No, give me a minute.
Speaking of embarrassing noises.
It's a good one.
Okay. Then unmute.
Right. You can hear me now?
Now
yeah, much better.
Okay, so when there are things passing out from the anus is actually normal because the anus is the colon is still alive. So when there are nothing passing through the colon, what will come out is the mucus, because the colon is still there. So and it's alive, and so it will continue to produce mucus every day, every hour, every second of the day. All right, so that we cannot stop it from happening. Eventually, as long as there's nothing passing through the colon, it will start to reduce. Then you will have very rarely, probably in a week, you will pass out probably once in a week. Okay, and that mucus is all accumulated in the rectum, and that's where you will have the urge to pass it out. However, as long as the colon is there, we cannot prevent this from happening.
Okay, thanks, Haida. Now, I think the question that I think Jessie asked was also whether sometimes the stoma is giving out loud noises and how to prevent it. Now, for that, I am going to refer to the in-house experts. I'm going to get Debbie. Now, Debbie, do you have any tips on loud noises from the stoma and what she can possibly do? And the next one I'm going to ask is Fong, since Fong says that she's the caregiver. All right.
For me, I will just press my stoma. So when we pass out gases or when I'm in the cab, I just press on my stoma and it will just stop for a while.
Yeah.
Yeah. So I will just leave the cab, and that's when the gas will just pass out by itself when I'm in a public area where there's nobody, not much people can hear.
Mm-hmm.
Yeah, that's what I would do.
Fong, what about you?
I'm okay with the noise. Just to get symphony is okay.
Yeah.
I was going to
Yeah,
say,
it's okay.
see, these noises are produced by everyone with or without a stoma.
Yeah, if you're in a crowd, what you can do is that you can actually look left at the person with a dirty look, and then I think that should solve the problem. I'm just kidding, of course, yeah. No, but I mean, seriously, Jessie, there is a list of foods that tend to produce more gas. So if it is something that's happening on a very frequent basis, cutting down on those foods may potentially help. Okay, but like I said, I don't think it's anything to be embarrassed about. In fact, passing gas is something that's very normal, and it's actually a sign of a healthy gut. Yeah.
So I always tell my patients to keep a food diary of how what type of food really gives what type of effect. And then with this food diary, you might want to take note of the list, okay, before you go out or before an event that you have to attend to, so that this will not be embarrassing for you.
Okay, the other thing is Fong and Debbie, do you all have any experience with air travel? I think there's a Mick K or Mike K that says that he just had surgery last week, planned to travel overseas by air with a stoma bag, and whether he can do so, how long, and etc. Debbie and Fong, have you all had air travel experience? Yeah.
For Sean's case, his stoma is in for only 6 months during the chemo. So during the we only okay.
Fong, you're breaking up again, sorry.
Yeah. What about Debbie? Debbie, any air travel experience?
Unfortunately, no, because it was COVID by then. Because I had my surgery last year, so I was in a recovery state. But I didn't travel by air, but by long day drive. Yeah.
Okay.
Maybe I can share a bit about long travel. I actually traveled to New York, altogether it was almost 24 hours of traveling. And there's really no problem. You just deal with your bag as you would deal with at home. so it doesn't inflate or explode or anything like that. So it's perfectly safe to travel. Just bring along a lot of spares. Yeah, and no issues at all. And there are travel documents that you can actually obtain when you travel, so that you don't have problem at immigration. And these are downloadable at the OAS website.
Okay. I think there was one more. Okay, I think Jacqueline answered the question about the stoma powder, right? So are we? Let me see.
Yeah.
Any other questions that we have? If not,
There's one last question, Dr. Tan, from Jesse. I'm not sure if anyone has answered it. Is it true for all permanent stomas, the anus is closed up?
that is a great question. Okay, so where is the question? I can't see it. Okay, I'll just answer it then. So most of the time in a permanent stoma, that means you're talking about colostomy at the left side, the anus is closed up, especially in the setting of cancer that is involving the anus per se. Now, in some instances, in very select patients, the anus is spared, but a decision not to make a connection is made for several other reasons. Okay, maybe because of the patient's state, the fact that the patient's intrinsic anal function was very poor. But medically, the cancer does not involve the anus, then it is possible to have a permanent stoma, but yet still have an anus in place. I hope that answers the question. Yeah. I think that's all right.
Okay, in the interest of time, we have one last question from Doris. So we'll take this as the last question. If any of you have any more questions, please log on to the OAS website or just send us an email. Let us know what you have to ask, and we'll respond to you after consulting the panelists, okay? So maybe Dr. Tan, you can just take this last question from Doris, who says, I have cervical spine injury and also carry a stoma pouch for almost 2 years. I still have frequent watery stool. How can I avoid it?
Okay, so it really depends on it really depends on what kind of stoma is created, whether this is an ileostomy or a colostomy. Like I mentioned, there is a list of foods that if your stoma output is watery, sometimes modifying your diet in terms of taking more rice, potatoes, starch-based products have a bulking effect on the stools. In certain cases, despite that, the stool output is still watery. That's when some antidiarrheal medications may help, because it helps to reduce the motility of the intestine and hence increase the time for water absorption to allow the stools to be harder and firmer. Sister Ong, Suhaida, you all have anything to add? You need to unmute yourself first. Yeah.
Actually, Doris, I know her. She's actually having a sigmoid colostomy. So she's having watery stool, which is actually a bit unusual. So we may need to sideline talk to her again why she's having watery stool. Need to look at her recent dietary intake and all those things. Maybe Doris, we can do sideline Q&A with you.
Okay, great, Sister Ong.
Right, so Doris, you have my number, right? You can always call me. Okay, so I address your issue as best as I can, okay? Right.
Thank
Back
you,
to
Sister
Dr.
Ong.
Tan.
Thank you, Sister Ong and Suhaida.
Yes.
Maybe it now leaves me to hand over back to Dr. Tan to wind up the
Okay.
closings for today.
All right, so I would like to thank each and every one of you for spending your precious time with us on a Saturday. Special thanks to Debbie and Fong. I think you guys have really been inspirational. And I must say that in the private chat group that all the colorectal surgeons in Sengkang General Hospital are having, and some of them are attending the talk, your stories have not just inspired the patients, they have inspired us. I think personally, I think it has inspired me to try to be a better doctor, to do more we can to help. So I just want to say that we are all in this journey together. The patients, you're not alone with just your caregiver. The doctors are with you. The WOCN team is with you. The vendors are here to think of products that can help to make every little bit of step easier. And last but not least, OAS is here. I think it's a great initiative. I'm very, very proud to be part of this endeavor this weekend. So thank you, everyone. Have a great weekend, and everyone stay safe and healthy. All right, take care.
Thank you very much, Dr. Tan, Dr. Fu, and all the other panelists, especially Debbie and Fong. Have a great weekend, people.
Okay, take care, everyone. Bye-bye.
Thank you. Bye-bye.